Hello, I'm Nicola. I'm one of the midwives here in the Rotunda Hospital, and today I'm going to talk to you about labour. So signs that your body is preparing for birth. Well, the first sign you're going to notice is that your baby's head will become engaged. And for you to recognise that, you will probably find near the end of your pregnancy a discomfort up on your upper belly, on your upper bump, where your baby's bum will more than likely be. So you will feel discomfort, you will be arching back when you sit down on a chair, and then one day you wake up and that discomfort will be gone. And that's your body telling you maybe your baby has moved further down into your pelvis. I'm going to show you now the doll and pelvis so you'll know what I mean. Now, so your baby, throughout your pregnancy, your baby is up here with lots and lots of room. And then near the end of your pregnancy, your baby will move down further into your pelvis, between each bone of your pelvis. And that's when you feel your baby's head will be engaged. So the next sign you might have that your body is preparing for birth is called the show. You might notice a show on your pants. And what that is a thick, jelly-like substance. It can be a little bit pinkish, can be a little bit brownish, and it would be on your pants. You can see on the pictures here on the bottom left, the mucus plug. It's also known as, another word is a show, and it acts as a protection for your baby. It sits in your cervix, as seen on the screen, on the picture, and then to let you know what it looks like, it's a thick, fat, jelly-like substance. So if you are 37 weeks or more in pregnancy and you notice this on your pants, there's no need to come into the hospital. It is a sign that your body is preparing for labour. But if you are less than 37 weeks of pregnancy and you notice this on your pants, do call us in the emergency room and we will advise you, because once you're less than 37 weeks, you are known as preterm. Another sign that your body's preparing for birth is braxton hicks. What is braxton hicks? Braxton hicks, as you know, your womb is a giant muscle and your womb will contract and relax. And when you have no pains with these tightenings, that is normal, that is okay, that is your body preparing for labour. So there's no need to come into the hospital. And I will show you on the balloon what is actually happening when you get braxton hicks. So with your womb, and this is your cervix, when you're having braxton hicks, your womb gets tight and then relaxes, and can get tight again and relax. And it does nothing to your cervix. They are painless and harmless contractions. You can feel these from any time from 27 weeks gestation. Waters breaking. That is one of the next signs that your body is preparing for labour. 80% of the time your waters will break when you're having contractions, and 20% of the times they can just break in general. When your waters break, you might feel a gush or you might feel a little trickle. If you think it is your waters, we do recommend you get a maternity pad and put it on your pants. With the gush of water, you will see the colour of your waters. If it's a little trickle, you won't have any idea, is it your waters or not? That's why putting on a maternity pad, you will see the white in the front, and that will be able to tell us the colour of your waters. There is an acronym that we do suggest you try and remember, is C.O.A.T. So what does C.O.A.T stand for? C.O.A.T is, what colour is your waters? Well, your waters can be a different variation of clear. So I'm just going to show you the colours now. So the first colour you might see is clear or straw-like colour, okay, and that's normal. And another colour then you might see is a slight pinkish tint in the waters. If it's blood, like a period, you need to come straight into the hospital. But if it's clear or a little bit pinkish, that is good. That's normal and no rush coming in, but you will always come into the hospital when your waters break. If your waters break and they are green, That means your baby has done their first little poo inside your belly, and the first poo your baby makes is called meconium. So that's telling us that your baby has done their little poo. So for that reason, you would come in immediately to the hospital. You would put on a maternity pad and come into the hospital. So with the C.O.A.T increment, the next one is odour. Do you find that there's an offensive odour from your waters? If not, okay, but if you do find there is an odour, you need to tell the midwife, so you need to come into us. The next one is A for activity. Is your baby moving? Is your baby moving the normal movements? Don't look outside what's normal for your baby. If you're anyway concerned about your baby movements at any time during your pregnancy, you would come into the emergency room and we would advise you and reassure you. So time, we ask, what time did your waters break at? And the reason we ask this is, there is a bacteria women have in their vagina, their rectum, and in their urine. It normally does us absolutely no harm, but research has shown that women who have this bacteria, it's very important that they get antibiotics in their labour to reduce this infection getting to their baby. So when you come into the emergency room, when your waters break, we will, with your consent, ask if we can do a swab in your vagina and your rectum, and we send it to the lab. It usually, on average, takes 4 hours for the result of this bacteria test to come back. If you're positive for that bacteria, we will call you at home and get you to come back into the hospital, and we will start your labour. If you're negative for this bacteria, we will also call you and have a plan in place for you to come back in 24 hours from when your waters broke in the first place. So the important things to remember with your waters breaking: when your waters break, if in doubt, put a pad on and come into the emergency room and we'll check it out. If your waters are clear or slightly little bit pink or straw-like, you know you've time to come in. If your partner is in work, you can ring your partner and tell them to come on home and you'll make your way into the hospital. But if your waters are green, meconium, or if you're preterm, less than 37 weeks, and your waters have broken, you would come on into the hospital yourself and ring your partner to meet you in the hospital.